Welcome to Sculpting the Soul, where we explore the art and science of transformative surgery. I'm your co host, Courtney Shaw, and today I'm thrilled to introduce an incredible surgeon and plastic surgeon, our esteemed host, Dr. Ram Kalus. Hello, how are you today?
Good, Courtney?
Very good. So, on today's topic, we're going to talk about something that has historically been a little bit taboo, the subject of vaginal rejuvenation and labiaplasty. So, Dr. Kalis, what can you tell us about what women need to know about both of these and the difference between each of those topics?
Yeah, thanks, Courtney. I think with social media, as you suggested in your intro, this is definitely not something that most women have historically learned much about,
Right.
talked about, and certainly even today not very comfortable discussing with their doctors. But let me just sort of make some order out of it.
Yeah.
So, the a quick anatomy lesson. Um, the labia, which is sort of the Latin term for lips,
Mm-hmm.
there is the inner labia and the outer labia, and they're known as the labia majora, the outer, and the labia minora, the inner. Most of the time, when we talk about labiaplasty, we're talking about the inner lips or the labia minora or the minor. And when women have too much tissue there, it can pose a functional problem and an aesthetic problem. The functional problem may be literally too much tissue there that may be visible or protruding with panties, tight jeans, bathing suit. It can interfere with exercise like spin class,
Right.
um, and riding a bicycle, and it can also be uncomfortable with intimacy because if there's too much tissue, it can chafe and rub, and there are even cases where there's an increased risk of yeast infections
Mm-hmm.
as a result. So, most women would know if they have a concern down there that they want addressed. The other thing that's very common is not only necessarily too much tissue, but very significant asymmetry, where one side is clearly much bigger or longer or excessive than the other. Now, this is an important point. Most women need to know that this is a part of the body that does not usually have perfect symmetry like we would expect in our lips or in our nose or in our face.
Right.
So, a little bit of asymmetry is completely normal, but most women would know if there's too much that is symptomatic and bothering them. What I discourage is to consider that you're a candidate for this if it's purely for aesthetic reasons. Now, that is an okay, legitimate concern,
Right.
and I'm not saying that it should be discounted, but most of the women who come and see us about labiaplasty for the labia minora, the inner lips, would have some of the complaints that I mentioned in the
Right.
beginning. The outer lips may undergo certain changes, either with aging or with significant weight loss, where they're not as plump and there may be sort of some loosish skin and it just doesn't look as pretty.
Mm-hmm.
And as plastic surgeons, we're certainly not averse to discussing those concerns, and there are techniques that can be used to do that as well, whether it's reduce some of that excess tissue or plump it up a little bit,
Right.
because what makes up the plumpness of the outer lips is usually some fatty tissue, which is normal. Um, the third part of vaginal rejuvenation
Mm-hmm.
is the possibility that if a woman has delivered one or two or three children, and it
Mm-hmm.
can be, by the way, just one, but if it was a large baby with a big head, there may be some loosening of the vaginal canal, which could be a source of discomfort for the patient or her partner if it makes intimacy less gratifying, etc. And so there is a surgical procedure wherein we can literally tighten the internal vaginal wall because things have gotten stretched out too much by one or more deliveries.
Right.
There are non surgical techniques also that use radio frequency that will tighten up the inner mucosa, the lining, and that can also improve lubrication.
Mm-hmm.
And they can even correct things like urinary incontinence, like stress incontinence, which sometimes happens after major deliveries where there might be some trauma to the urethra.
Right.
But those areas are the main concerns that would bring a patient possibly to see us. With part of the labiaplasty, where we do a reduction of that tissue, there may also be some excess tissue that patients complain about with overhang over the clitoral hood. And that is something that we assess. We find out if this is a concern to the patient, and that can be combined with a labiaplasty. But the surgery is generally very well tolerated. It's outpatient. And depending on how much we need to do, believe it or not, it can be done under local anesthesia in the office setting,
Yeah.
or it can be done under general anesthesia if the patient wants to experience absolutely zero discomfort.
So the perception is that you would possibly just have to go to your gynecologist, which is where we go to the doctor when it comes to that specific region of our body. So tell me a little bit about how you would know or determine whether to go to a plastic surgeon or your OBGYN for things that we just discussed.
So that's a great question. And labiaplasties are performed by some gynecologists, not all.
Mm-hmm.
The area, I don't need to tell your listeners, is obviously very, very delicate. And historically, plastic surgeons are used to doing very delicate surgery. We operate on eyelids and we operate on the face. And so we're very well versed in the delicate surgical techniques of delicate surgery.
Mm-hmm.
And some OBGYNs are not comfortable undertaking that.
Right.
And so our greatest source of referrals, in fact, are the OBGYNs who choose not to do that kind of surgery, but they might recognize in their patients the need for that, and they would refer them to us. The patient who isn't sure about whether or not she has a problem
Right.
can consult either with her OBGYN or with the plastic surgeon. But I would say, realistically, Courtney, most labiaplasties performed today are probably performed by plastic surgeons.
Very good. And you talk about downtime. Tell me a little bit about that. So I know you said it can be kind of out of patient or out of
Outpatient surgery?
outpatient surgery. Thank you. So what does that look like for the rest of their day, their week? What is the downtime?
So most patients probably feel about 75% recovered within 10 days to 2 weeks.
Okay.
And we're probably going to ask them to be careful
Mm-hmm.
with some of the activities I mentioned before
Right.
for 4 to 6 weeks with regard to like a spin class or riding a bicycle or horseback riding
Right.
or sexual intercourse. We probably want to wait about 4 to 6 weeks to make sure that everything is totally healed.
Very good. And so if a patient is ready to take that next step, what is the process at your office?
So they simply need to contact our office and let our staff know what it is they want to come see us about, because my staff would know how long it usually takes to have a thorough conversation and educate the patient about everything she needs to know. And that's pretty much it. They can just visit our website, drkalus.com, and we would be happy to see them.
Very good. So thank you again for joining us today, Dr. Kalus. It's always a pleasure to work with you and to have these conversations that most are kind of uncomfortable having. Thank you for being an outlet. So again, thank you for joining us today on Sculpting the Soul. Remember, beauty is not just about looks. It's about your confidence and feeling your best. So until next time, we will see you soon.
Thank you, Courtney.
Thank you so much.